healthcare is that you have to have organizational skills. This was one of the things that I realized when I was a nurse, that I'm given so many duties and there's not enough time to do them in, or sometimes I feel that way, that there's not enough time to do it. I like the fast-paced environment. Some career fields are less fast-paced and some are even more fast-paced. So if you wanted to work in an emergency room, you have to be highly organized. That you're listening to the scanners when they're coming in for the patients, you're prepared, you've got your bed ready for the patient to get in there, and we have a good idea of how we're going to treat them once they get there. You have to be organized, and along with that organization and prioritization, you have to have good clinical reasoning. Our patients are puzzles sometimes. Sometimes they come in, we do the lab work, we're like, yes, we know what's wrong with you, we're going to be able to treat you, and we send them on their way. Now, sometimes they present with vague symptoms, or it's just a puzzle. I know for myself, I kind of like watching those crime scene investigation shows, or I do like watching Grey's Anatomy, but sometimes it's not always realistic in the show, but it's a puzzle. We get to do all these different tests with our patients, and based on all of those findings, we make a good clinical judgment on how to care for our patients. Not every one of our patients are the same. Some patients may have the same illness but present very differently, and we've got to use our knowledge that we were taught in school and our skills to be able to care for them effectively. We're constantly doing new research in healthcare, and it's changing how we care for a patient. What we did 10 years ago is not what we're doing today. Or I've met nurses who have years and years of experience, and they remember taking heat lamps and putting them on wounds to heal wounds. They thought that that's what healed wounds in our healthcare patients. It's not, actually. We want to make sure that that wound bed for our patient is slightly moist, but not too moist. And now we have wound vacs out there that we use on our patients. Who would have thought that we would have put a vacuum type of device, seal it up, and put it on a wound? It's pretty crazy. You can probably Google a video clip where they use the wound vacs. It's pretty neat. Most of them, though, you're going to see those wound beds, so if you're not into the bodily fluids, be careful. Verbal and written communication. We do recording and we do reporting. So when we're recording, we're writing that information in the chart. If it's not written, it's not done. So we have to make sure that we can chart effectively and take the time to paint the picture of what happened with our patient, because people use that chart to figure out what happened to the patient previously and then how are they going to care for them moving forward. The other thing is it can be pulled in a court of law, so you always want to make sure that you're charting effectively. Verbal communication, we have report between shifts, report between departments, so that everyone on the team can care for our patients effectively. So verbal and written communication is of the utmost importance. Thank you for taking the time to listen to this video. If you have any questions, you can always email any of us instructors on the course. We will gladly help you through. We hope that someday that you'll want to be a healthcare provider just like me or any of the other ones on the team.